Hey, my name is Dr. Kyle Konis, and I wanted to go over this scoliosis community awareness presentation. This is just something that I wanted to make available so that we are able to further educate our community. And here in the Northern Michigan area, there are people that suffer with scoliosis and don't, know the options that are out there for them or for their children and what can be done. And so this presentation, we're going to go in depth. This is longer, and so this is if you're really looking for answers or information on scoliosis, maybe you've been diagnosed. And so we're going to cover a lot of different topics here. So we will go ahead and dive in. So first of all, what is scoliosis? So if we talk about what is scoliosis, it's a curvature in the spine, right? So if we look at the spine from front to back or back to front, it should be nice and straight up and down. And instead, you see this S shape or C shape curvature through the spine. And that's what scoliosis is. Now, there can be many causes. In children, it mainly occurs in adolescent girls starting between 10 to 12 years of age. It can certainly happen in boys as well. It's just more common in girls. And unfortunately, scoliosis will usually get worse with growth or age. That's why it's important to be caught early, because as children go through puberty and their biggest growth spurts, that's where scoliosis is in danger of progressing the most. And also, adults can have scoliosis, stemming from adolescence, or more commonly, develops later in life for them. So if the bend of the spine, so if the curvature of the spine gets above 50 degrees, oftentimes surgery is recommended. And patients with scoliosis can develop back pain, asymmetry in their body appearance, and postural deformity, as you can see here. So what does scoliosis awareness mean? It means being aware of what scoliosis is, right? Kind of knowing a little bit about it, being aware of who can be affected, understanding and recognizing the signs of it so that we can catch it early, which we'll talk more about. Knowing where to find appropriate treatment if treatment is needed, and then sharing this information with family and friends. You can really, save somebody's life with this information. Now, who can scoliosis affect? At the end of the day, it can affect just about anybody, but there are certain people or certain parts of the population where it is more common or they're more vulnerable. So the prevalence of scoliosis increases with age. About 30% of the population over 60 years old is estimated to have an adult scoliosis. That is pretty crazy. So almost a third of the population of people over 60 years old are estimated to have an adult scoliosis. It can run in families. There is a hereditary link there. And prevalence increases rapidly from 11 to 14 years of age as children grow quickly. And that's what I was saying earlier, is that's really the prime time where if it's not caught during that time, it can progress extremely rapidly, even over the course of 6 to 12 months. Now, an estimated 2 to 3% of children that are aged 10 to 15 years will have scoliosis. That may sound like a small number, but if you think about it, if you got, 300 kids in your child's grade, that means, 6 to 12, somewhere in that range, are going to have scoliosis. A lot of it going undiagnosed and untreated, unfortunately. And then even infants and juveniles can also have scoliosis. And so that's pretty rare, but there are cases where infants and juveniles, we say juvenile, we're looking at people under 10 years old. So why does it happen? Why do you get scoliosis? So oftentimes, especially when it's in adolescents, the younger population, oftentimes it's called idiopathic scoliosis. Idiopathic means of unknown origin. So research has shown that there may be a family link, but not always. We've seen patients that don't have scoliosis in their family that get scoliosis. And here's the interesting thing. We do know that it is not just a curve in the spine, but the bones of the spine change shape the bigger the curve gets. So the bones, as these kids are growing, actually change shape and they deform so that the spine actually forms in this way. It's not just only the shape of the spine, but the bones are actually deforming as well as the child grows. Now, when we talk about adult scoliosis, could just be a scoliosis which was present when the person was younger and it just never got diagnosed. So that's obviously one way that we can have adult scoliosis. But it can also, and more commonly, be caused by degeneration of the spine later in life, and that's called de novo scoliosis. So degenerative scoliosis in older adults is the most common form of scoliosis. We know that that's the biggest population that has scoliosis, and the most common way it happens is from degenerative scoliosis. So another reason to take care of your spine throughout your life. What we do know right now, early and accurate detection leads to the most appropriate treatment. It can be the difference between a patient needing to undergo surgery or not. Even in adults, the earlier appropriate treatment is started, the better. The easiest scoliosis to treat is the smaller scoliosis. The larger scoliosis gets, the much harder or sometimes impossible it can be to treat, and where surgery may be needed, which scoliosis spinal surgery is not a fun thing to undergo and something that we don't wish on anybody. So in terms of the research, what does the research say? The Scoliosis Research Society, which is the premier spine society when it comes to scoliosis, says there are documented benefits of earlier detection and non-surgical management of adult idiopathic scoliosis. So like we're saying, early detection and non-surgical management is the best route we can go. So if we're going to catch it early, we really need to recognize the signs of scoliosis, and this is where that community awareness piece comes in. We want people to be aware and be able to recognize this. So unfortunately, there's no consistent formal scoliosis screening programs in place in schools across the country. And so it was more popular, years ago, where every child would get screened maybe by the school nurse, and they would just kind of get them feeling down their spine and seeing if they felt any curvatures. That's one way to do it. Unfortunately, there's a lot of scoliosis that's missed that way. And then there's some people who were told they have scoliosis that don't actually have scoliosis. But it's important that we can all recognize the signs. And now that there's no formal thing in every school across the country, we got to make sure that we are on top of this for our children's sake. Summer is especially an opportune time to checking kids' backs for any signs of scoliosis, because we're in bathing suits, no shirts, different things like that in the summer. So that's an easy time to just take a look. Now, here's where we'll get into some details. From a standing assessment, okay, anybody can do this, very easy. Have the person stand in front of you with their feet slightly apart. So just standing normal in front of you with their arms just hanging to their sides. Nothing special there. Here are 5 things that we want to look for. Number 1, are their shoulders uneven? Is one shoulder appearing higher than the other? Number 2, is there a prominent shoulder blade on one side? Does one shoulder blade stick out a lot more than the other? Number 3, is there a visible curve of the spine? Can you actually see a curvature and a scoliosis in the spine just by looking at it from the back? Number 4, are the hips uneven? Do one of the hips seem to be higher than the other? And then number 5, is there asymmetry in the waist? So you can see in this picture here, there's a little more fold in the waist at one side and it's much flatter on the other. So those are all signs that we can see. Now, forward bending assessment. So this one, pretty simple as well. Anyone can also do this. You have that same person standing in front of you. They're just going to be in that same position, but they're going to bend forward and try to reach for their toes is essentially what you want to think here. So just let the arms dangle, put the palms together and the fingers pointing down. And here's what we're looking for. We're looking for a thoracic rib hump. So where the rib cage actually looks rotated, where one is bulging out more, one side's bulging out more than the other. And then if they bend a little further forward, you could see a lumbar bump where one side is more elevated than the other. And here's something a lot of people don't realize with scoliosis, and why we can see this on these checks is scoliosis, a big component is that it actually has rotation. So it's not just an S or C curve of the spine. The rib cage actually rotates, and that's what gives us these rib humps that we can see, why a shoulder blade may stick out further than the other. That's where some of this comes in. It's actually a 3D deformity. It's not just in one plane. So these signs, if you see any of these, they may indicate a possible scoliosis. And again, we say a possible scoliosis. We're not going to sit there and tell someone they for sure have scoliosis without a diagnostic x-ray. But they could have a possible scoliosis, and it should be followed up with by a qualified scoliosis clinician. So what can you do at home? We just went through that screening process. We know that early detection is crucial, and the cool part is new technologies can play a role in at-home screening. So parents and friends can check loved ones in the comfort of their own home with some technology. So there's actually something called Scoli Screen, which is a really cool app that can be used. You can also use it just online, but a free web-based screening tool for scoliosis. And it can identify important signs and risk factors that may indicate that someone either has or may be developing scoliosis. And it just walks you through 8 simple questions. That's very easy to use. Anyone can use it anytime. You can see right here, you can go to app.scoliscreen.com to be able to use that. Here's the 8 questions it's going to ask you. Very simple. Do their shoulders look uneven? Does one shoulder blade stick out more than the other? Do their hips or waist look uneven? Is there a noticeable curve in their back? Then have them bend forward slightly like we talked about. Is there an obvious hump or bump on one side of the rib cage? If they bend a little more forward, is there an obvious hump or bump on one side of their lower back? Is there family history of scoliosis? And are they male or female? And those are the 8 simple screening questions there. And then it'll give you a result, right? Low risk, medium risk, high risk. And then you're able to go from there, and you can even find your nearest scoliosis clinic. So you can even, share this with people who are out of state or in a different area than you, so they can get the appropriate care. So what happens if a scoliosis is not detected or treated early? That's a big question. We like to say large curves were once small, and early diagnosis is in your hands, right? Every curve starts at 0 and progresses from there. It can't happen any other way. So we want to catch these curves before they get large, because then they can become very hard to treat, or in some cases not treatable, and you have to go the surgical route. So if we look at this, we talked about earlier that especially in certain populations, so if your child is basically 10 to 15 years of age, or if patient is 60, 65 years or older, this can develop very rapidly. Typically, if you're between, 18 years of age and, 60 years of age, you're pretty minimal risk for it getting much worse on you very quickly. But this is a good example. So we got a normal spine on the left. Here is a picture of what someone looked like in a pre-consultation. And here is 1 year later, the same person with this left untreated. Look how much that progressed. And so that is, that is just an example of how quickly this can happen and why things should be monitored and why those age ranges are so crucial. So what about treatment? So each case is obviously different and requires expert assessment and the right treatment. So when it comes to small postural curves where the scoliosis is less than 10 degrees, no scoliosis-specific bracing is normally needed. So usually just chiropractic care and rehabilitation through chiropractic biophysics is the first choice. We still want to make sure that this is specific towards treating a scoliotic type spine and that they're getting the appropriate rehab that they need. And so that's where chiropractic biophysics can come in and really be the first choice. But we shouldn't need to do any bracing with this person, which we'll talk about more in a minute. And then we just want to have careful monitoring, again, to make sure we don't get any rapid progression as we go if they're in those kind of dangerous age ranges. Now, when the scoliosis is larger than 10 degrees, that's where, we want to have a full assessment by a scoliosis clinician. Scoliosis-specific exercise is often the first choice of treatment for small scoliosis with curves less than 20 degrees. But again, every case is different. We may need to do a little more than that, just depending on the likelihood of progression, which there's a lot of factors that are evaluated in that appointment. In cases with strong family history of scoliosis or the patient's preference, nighttime or part-time bracing could also be considered when we're under 20 degrees. And again, this is custom overcorrection bracing that ScoliCare does, is the best brace in the world and can actually reverse a lot of the scoliosis cases like we'll see here. So specialized scoliosis bracing, when prescribed for high-risk adolescent patients, has been shown to prevent the need for surgery in most cases. This is phenomenal, and this is newer over the last 10 to 20 years of being able to get this technology and make these differences for our patients. And bracing is an effective treatment method for adult idiopathic spinal scoliosis cases as well. So not just for kids, but we can do bracing on adults. and has shown very positive long-term outcomes. And then part-time bracing in adults has been shown to significantly reduce progression of curves and really improves quality of life. And so there's data on all of these things. So again, now, best time to start treating scoliosis if you have it was yesterday. Second best time is today, right? We want to treat it as soon as we can detect it. So regular screening plus detection really gives us better outcomes in treatment, which is what we're after here. So you can see 13-year-old patient here, 33-degree scoliosis. There's the initial posture assessment. Here is the patient in their custom 3D Scoli brace, which uses an overcorrective approach. So these are made, this brace is made specifically for this person off the x-rays and off of 3D scans that are taken in the office. There's the postural assessment after 12 months of treatment. Look at the difference there. And then here's the improvement. This is an out-of-brace x-ray after 22 months of treatment, including bracing and in-office care, 27-degree improvement from 33 degrees of scoliosis down to a 6-degree curvature. If we want to look at younger, here's a 3-year-old patient with a 40-degree scoliosis. That's the initial posture right there. Here in a traditional brace, and here's the difference between an overcorrective Scoli brace and just a traditional brace maybe from the hospital. In the traditional brace, they took an x-ray, there's still a 33-degree curve. So it did improve it by 7 degrees, but still looking at a 33-degree curve in the traditional brace. Then putting the patient in a Scoli brace, which uses the 3D overcorrective approach, improvement is out of brace, not even wearing the brace. After 24 months of treatment, 26-degree improvement down to 14 degrees of curve. So from 40 down to 14. So if we catch this early, it can make a big, big difference in this person's life. So be proactive, be scoliosis aware, right? Look after your spinal health. Do regular at-home check-ins with, yourself or your children or your grandchildren. Don't watch and wait. Seek professional advice because, a lot really hangs in the balance if we take the right approach here. So I hope this was helpful. I hope this was informative. If you have further questions, you can reach out to us. We're here in Traverse City, Michigan, at Shift Health Center. We are certified through Scoli Brace and Scoli Care. And there's our email, info@theshifttc.com. And then we also have our phone number there, 231-846-8897. You can reach out to us if you have any questions. And I hope this was informative.